Just like industries such as aviation, railways, or the energy sector, healthcare technology is highly regulated. After all, people's lives are at stake. But who makes up the rules? And how do we know that manufacturers are being playing by them? Hello, and welcome to The Evidence Space, a podcast produced by the Institution of Engineering and Technology, which brings you conversations with leaders from health, care, and life sciences. I'm your host, Dr. Peter Bannister, and with me today are Eleonora Harwich and Claudia Martinez from the policy think tank Reform. Eleonora, Claudia, welcome to The Evidence Space.
Thank you.
So can I ask you to start by introducing yourselves and giving us a fun fact for the listeners?
Sure. Claudia, do you want to start?
Okay, sure. That's absolutely fine. Yeah. So my name is Claudia Martinez, and I am health policy lead at Reform, which means that I oversee sort of all of our activities related to sort of healthcare. And I've had the pleasure of being involved in this very exciting project that we're going to tell you about later on the regulation of data-driven technologies in healthcare. And oh my goodness, for a fun fact, I would say that I'm very much into karaoke, and this is a bit of a family tradition, something that we do basically every week. So yeah, especially now with the pandemic, it's gotten to whole new levels.
It honestly has like absolutely amazing. I must admit, sorry, Claudia, to reveal your secret, but she did tag me in this little Instagram video of her singing the Little Mermaid song, which I very much enjoyed because I was a very big Little Mermaid fan as a child. So I was, yeah.
Talent. And how about you, Claudia?
So I'm Director of Research at Reform, which means that I kind of help develop the research agenda and strategy for the organization, also in charge of the kind of quality assurance process for projects. And also, I guess, have fundraising responsibilities and other kind of responsibilities that are attached to being Director of Research. In terms of my fun fact, I actually had prepared two, but I will go for one that might sound a bit weird. But when I was a child, I was quite infamous for being a napkin thief. And I just used to go around people's places stealing napkins. And the reason for this was that I used to use it as either bed sheets or little kind of tablecloths for my teddies. So I just had a huge collection, which my mum one day found and was like absolutely mortified.
So if anyone's missing any napkins, you can write to us at the Evidence Space, although probably not on the back of a napkin by the sounds of it. So to kick off this episode, you were both recently awarded Outstanding Contribution to Tech Regulation at the COGEX conference for your work in healthcare. Can you tell me a little bit more about how you got involved in that initiative?
Sure. So actually it's the way that I see it is kind of a long journey. It kind of all started, I think, when I had done a project in 2017, 18, looking at the applications of artificial intelligence in healthcare, specifically in the NHS. And it was a kind of broad brush view of what was going on, understanding the barriers. And then it had a whole section quite at a high level about regulation. And it kind of stayed in the back of my mind as like a topic that was really important, that potentially needed its own deep dive. And I think, after publishing a few papers that were kind of related to the digital health agenda, I just thought to myself, we absolutely need to do this now. And so that's how we started, really. And to be quite honest, the project morphed because I remember when Claudia and I kind of first started working on it, we thought, okay, we're going to produce I guess the typical policy think tank type of output, which is just a simple report. And actually it was through the interview process that we met up with the team at NHS England at the time. NHS X didn't exist, and kind of started talking about things with them. And then eventually the kind of partnership emerged quite naturally off the back of that. And yeah, that's how things started, really.
You mentioned NHSX. Both within the UK, but also globally, there's been a rapid adoption of digital health over the last few years, including, as you mentioned, artificial intelligence. How did that contribute to the emerging set of standards and guidance for the regulation of these new types of technology for health and care?
I think that's actually quite an interesting question, because what you find with regulation for data-driven technologies is that you don't really have a specific framework that applies to data-driven health. And that's because many parts of the process are already regulated by other sort of regulations. So patient data and medical devices. So I guess the question that we had when we started the project was, let's look at the pathway, at the regulatory pathway from beginning to end, and let's really try and understand the different barriers and pinch points, and some people call it pain points, that people find as they go through the pathway. And that goes all through sort of the point at which an innovator might have an idea for an amazing new technology, to all through the point at which they are able to commercialize it, and they need to be thinking about post-market surveillance and how to monitor the performance of the device. And one of the things that I found really interesting about this project is that obviously the regulation is really, really evolving with the new technologies that we see. And AI and machine learning are definitely changing the way that we think about regulation. And there are some things that existing regulation already covers, but others that, how do I put this? There are some gaps that we need to address.
And even though your focus was on the UK health system, how much of the time did you find yourself referencing international guidance as well?
So at times, I think potentially not as much as if the intention of the kind of project was to, understand what needed to be done to plug those gaps, because the remit of the project itself at first was really just a kind of understanding what the kind of current baseline actually is. And so the kind of specific remit that we had was to just map the current process, current gaps, and that was it, to then kind of give that as almost like a kind of template of these are the kind of pressure points or things that are not kind of working that well right now, which is why actually in the event that you came along and obviously moderated, Peter, with Imperial College that we did kind of subsequently, which was looking at how you might be able to solve some of these problems. I think then in that kind of write-up process, I think it's easier to then kind of look at, what is the FDA doing? What is their approach to kind of risk classification, to different things? Whereas here it was, I think the kind of constraint of the project meant that we didn't do as many international comparisons as we potentially could have.
Yeah, exactly. And the other thing that we really wanted to do with the project was to look at the role of the different regulators. So when we started the podcast, you were talking about sort of regulators and other bodies that might offer guidance, and how do you go about sort of making sense of the different regulators, but also the other types of things that you need to take into account. What I thought was really key for us was to realize that the process is not particularly straightforward. So it can be quite complicated for an innovator to actually navigate the pathway. You need to engage with 5 regulators and then a bunch of other statutory bodies and arm's length bodies that will offer you guidance and frameworks and things that you need to be thinking about. Is not only about getting your product on the market, but also about how do you get it commissioned by the NHS. I don't know, it's fascinating. We're regulation junkies, to be honest.
Yeah, I would also say that actually that kind of separation between guidance and regulation and what guidance is most up to date, and how does the guidance from one body then maps onto the guidance of another body? Does it contradict or not? I mean, it honestly was, I think, the most difficult thing to do in terms of research was really to understand, okay, what's the most up-to-date piece of guidance for one, which might seem like a very simple question, but actually it isn't, just because that information is quite difficult to find. And you might, we kind of, I guess the general kind of feeling when we were researching this project was, we thought we were done with something. And then eventually we landed on this web page with another piece of guidance and another set of principles. And we're like, oh God, no, we have to update and rethink. And it was that constantly. And I honestly thought I got to a point where I just thought to myself, we're never going to be done. Because there's just always something.
I think we were very lucky to be able to engage with all of the regulators, which really, really helped. So we held workshops and conversations. So that was really useful, just to be absolutely sure that we were considering sort of the latest and most updated guidance and regulation across all of the topics that we were looking at.
So it sounds like you've done a lot of hard work that I doubt many engineers would want to take on. Coming back to this idea that there's so much out there that you could potentially be required to follow, how does one distinguish between the regulations that you're absolutely required to follow and those which might be irrelevant or at least optional? We've already talked about the words regulation and policy. How would you make a distinction between those two things in the health and care space?
So I had a quick stab at actually just taking a couple of notes on this question, because I actually thought it was a really interesting one, because sometimes I think it's a bit difficult to separate, but I think at a kind of most basic level, really, the main difference is that if you don't follow policy as a kind of entrepreneur, you could still do what you do and it could still be deemed legal. I think the kind of difference is that if you don't follow regulation, then that's absolutely not okay. And I think that's the kind of really biggest distinction, is that following policy might be optional. It might create obstacles in you actually being able to then sell your product to the healthcare system, because then it's just hard to make sense of, how does this integrate into the kind of wider policy vision for the healthcare sector? And you might find it potentially slightly more difficult to articulate your value proposition in terms in which, I guess, people working within the healthcare system might understand. However, you still be completely in your right not to do so, whereas not following regulation is obviously, again, not an option. Although, to be quite honest, the likelihood of you being caught when you're a category 1 device is quite low, because there is literally no kind of audit whatsoever. So that's, I guess, but that's the kind of thing that is worrying me a lot right now, actually. But at a kind of more meta level, I think policy is more about setting a kind of direction of travel, and that direction of travel can be either a kind of change of modality of the delivery of care. So say, for example, I don't know, the NHS's shift to a kind of digital first approach in healthcare. That is a kind of policy goal, which is literally just a change in modality of the delivery of care. But it can also be the type of levers that you might want to put in place to achieve a specific outcome. So it can be, I don't know, empowering the patient or reducing healthcare inequalities or whatever that is. And there's obviously an interaction between both, because, to be able to kind of achieve the policy goal of, say, empowering the patient through, I don't know, the use of the digital first approach, you need to make sure that the regulatory framework is there in place to be able to support those goals, to make sure that you achieve them in a safe way, and that you potentially limit, any kind of adverse effects that you might foresee. So I guess that's how I would portray the distinction.
Yeah, I completely agree. I think the way that I see it is essentially regulation are the rules of the game. It basically tells you what you can and what you cannot do, and what can happen to you if you don't comply with the regulation. And as you say, policies are sort of those high-level principles that tell you, okay, this is what we want to achieve, but also how we're going to do it, how we're going to go about it. But yeah, it's a really, really interesting question.
So earlier you've referred to a class 1 device. For those of our listeners who may not be familiar with the way that medical devices are classified, what you're referring to there is the system where devices are classified based on the increasing level of risk. Risk is what could go wrong if they didn't perform as expected. So the least risky devices are class 1, all the way up to class 3, which are the highest risk devices, of course. So those are ones that have got life-supporting functions, or if something did go wrong, could lead to an immediate and serious injury or even death. So because the regulators have got a limited amount of resources, they quite naturally focus their attention on inspecting the high-risk devices, which means that manufacturers of the lower-risk devices are in many cases left to follow the rules themselves.
For class 1, for low risk devices, it is literally you mark your own homework. But it's, so to me, there's a specific issue with class 1 devices, which is kind of dual, which is one, you mark your own homework, and you obviously, regulators do check if it abides to the kind of standards that they set out, but no one is really going to kind of dig a bit deeper to actually see if the kind of evidence that you supplied is actually true or not. And then the second thing is that ultimately on the Apple App Store or Google Store or whatever it is, there's still loads of apps that could be classified as medical devices that are not. And I think that that's the kind of scarier thing, is that ultimately, because there is no audit function of the App Store or the Google Store or wherever you download your apps from, I think that's when you find the kind of really, I don't know, like really surprising commercial claims. I actually, the reason why I kind of have this on my mind right now is that I read a friend's thesis, which was literally on this. And some of the commercial claims and things that people say are just, quite surprising and very scary when you kind of look at that class 1 device. So say, for example, fertility trackers or apps or that type of stuff that kind of track periods and fertility and so on. Some of them claim that they can actually increase fertility, which is just like, how is that even logical and possible for you to add that in the description of a product, that an app is going to somehow increase fertility? And that's where you see like really quite, like completely unsubstantiated commercial claims and total lack of evidence whatsoever, really.
Yeah, well, that's beginning to be sort of addressed, right, with the whole sort of introduction of the new medical devices regulation in 2021, which I think is going to be a huge kind of improvement in that respect, because all of those class 1 devices will be upclassed, which means potentially that you will have a system whereby you can kind of check a bit more all of those claims, and that the evidence is actually there, and that you can sort of ensure that things perform safely and efficiently.
I do agree to a certain extent, as in for some of them, for those that will be upclassed, yeah, for sure. But then I think there's still going to be a kind of almost like latent proportion of them that are still going to stay in that kind of gray area of class 1. And I guess one of my issues with the way that things work currently, and I completely understand it's a kind of capacity and resource thing, but I do think that if we want to do digital health right, we are going to need to invest in some sort of audit function for this. I guess the same way as HMRC does random tax audits, there's no reason why you couldn't do random audits of what is on the App Store to just check that, at least the App Store, the kind of Apple or Google one, or whatever one you're kind of using, are also complying with the kind of new requirements that are going to be imposed with the new medical devices regulation, where they as basically distributors of apps will be responsible for the kind of accuracy of the information that is put out there. But yeah, I don't know. To me, it's like, as long as, if there is no kind of incentive almost to kind of make sure, because there will be a sanction either by regulators or whatever it is, I just don't see how it's fully going to change.
But it sounds to me, from what you're saying, that it may not be realistic to expect the regulators to catch up with all those devices. So there's an argument to help the user, I guess usually the patient, have a better awareness of some of the risks they're taking when they might be using less regulated, or even in some cases unregulated, medical devices.
I was seeing this thing the other day, which was a paper, and now I'm definitely not going to remember the title nor the author, so again, apologies. I did read it somewhere.
But and come back on this. So.
Yes. Okay. Great. And it was about basically almost creating like a sort of you know how on drugs or even on food, you almost have like a fact sheet of like what's in it that is presented in an understandable way. that can obviously kind of help with consumer choice and empower consumers to make better decisions. Maybe there is a kind of avenue like that, which would allow people to kind of make better decisions, which would, be kind of simple fact sheet that you would just present the information in. Maybe that's a way of going about it as well. Don't know who would develop those standards, but
yeah, exactly. Or maybe testing something like the Orca model, or something that allows you to have sort of a standardized way to sort of make sure that the apps that you're using, and especially the apps that are being commissioned by bodies like the NHS, have all of the most appropriate evidence that you need to make them available.
So Orca, ORCHA, is like a gatekeeper organization looking at digital apps, which are actually in the process of trying to get adopted by the National Health Service in the UK. So it sounds like a way of delegating that specific role of practical evaluation. Policy here is things you aren't compelled to follow, but if you don't follow them, you might find yourself at the back of the queue behind other manufacturers who are following.
I was going to say that. I mean, the capacity issue and the resourcing issue is not insignificant, because, I mean, all of the conformity assessments, that's sort of the process that you have to go through in order to obtain the CE marking, which is sort of the accreditation that allows you to place a product, a medical device, on the market. And that can be software, that can be an app. That's usually done by the notified bodies that work with the MHRA, which is the Medicines Healthcare Products Regulatory Agency. And obviously with Brexit and everything that's happening, there will be sort of more pressure on these notified bodies to actually do more. When we're thinking about the upclassing of those devices, that will go to them. So yeah, if we can find ways to actually delegate some of that responsibility in a way that works and that is accessible and that it's affordable to the system, I think we should do so.
So I think in some ways it's very interesting you mentioned the CE mark, because drawing parallels with the engineering domains industries outside of healthcare, many people, both engineers but also consumers in general, are familiar with the idea of a CE mark. It signifies some level of safety compliance if you buy a children's toy or an electronic device like a radio. In Europe, though, the CE mark is also a requirement for healthcare devices, and in those cases signifies that the manufacturers met all of the relevant regulations for their intended use. And similarly across the globe, there are equivalent requirements. So, for example, in the States, there's the Food and Drug Administration, who also authorize devices. I guess to me, that underlines the transferable skills in terms of understanding safety and performance requirements that many engineers already understand. But as we get closer to the detail, and despite all of this guidance, it sounds like it's still challenging for a manufacturer to determine what rules they may or may not need to follow when validating their device.
Yeah.
Ellie, Claudia, we're running out of time, I'm afraid, but I'd really like to carry on this conversation in the next episode of The Evidence Space, if you can stay with us for that. In this episode of The Evidence Space, we focused on the topic of regulation of new technologies for healthcare and life sciences. We've heard how these industries deserve their reputations for being highly regulated, and yet there are ways in which manufacturers can jumpstart their pathway to compliance. Key to this is to first be able to understand and describe the intended use of the new technology. Once this has been characterized, it's possible to work out which regulations apply and what kind of evidence needs to be collected to satisfy them. We've also explored the relationship between the regulations and other forms of guidance such as policies. Policies, for example, can move more quickly in response to enthusiasm for the potential offered by new technology, whereas the regulations may take longer to catch up. However, while the regulations are mandatory, we've also heard why it makes sense to comply with policies as well, in terms of ensuring adoption by clinicians and patients alike. Join us in the next episode, where we'll learn more about how to reconcile the potential offered by new technology with the role of the regulations in ensuring the safe and principled use of that on patients. We've hoped you've enjoyed this episode and found it informative. As always, if you have suggestions or comments for future episodes of The Evidence Space, please do get in touch. And thank you very much for listening.